My Lords, I rise to speak to this group of members, but particularly to move at the appropriate time my Amendment 12, and again to declare my health interests in the register, especially as a trustee of the Centre for Mental Health and as an honorary fellow of the Royal College of Speech and Language Therapists. At committee stage, as we've heard, we had considerable discussion about membership of ICBs. And I argued in an amendment in my name that membership of ICBs should include a representative of a mental health trust. And I also supported amendments that allied health professionals, which make up about a third of the health and social care workforce, and of which speech and language therapists are a crucial service, should also have membership on the board. However, as we've heard, the government rejected the arguments then, principally on the grounds that they made membership too prescriptive and inflexible. Now, the Minister, Lord Kamal, with strong support from Baroness Walmsley, which I really welcome, have instead brought forward Amendment 31 regarding, amongst other things, the need to review the skills, knowledge and experience of board members and to take steps as it considers necessary to address or mitigate that shortcoming. Clearly, this is very important, and I do not oppose Amendment 31, and certainly hope that, as the Minister has indicated, that allied health professionals, such as speech and language therapists, will be part of that review and be part of the board. But the amendment does not ensure that the critical areas of healthcare, particularly mental health, are at the table when the ICB boards are established. The Government Amendment 31 is retrospective, looking backward at possible lack of knowledge and expertise after the event, while ICBs are the crucial forum where decisions will be made about millions of pounds of NHS funding, as well as choices about priorities and system changes. So membership of ICBs really matter from day one. It cannot be left to chance or adjusted inconsistently over subsequent years. Further, I remain concerned that if the voice of mental health is not in the room from the inception of ICBs, there is a danger that the very powerful interests of acute trusts will dominate the agenda and could lead to undermining the not inconsiderable progress, as we've already heard this afternoon, towards parity of esteem between mental and physical health. So my new amendment on mental health representation tries to overcome the government's criticism of overprescription and inflexibility by proposing that at least one member of the ICB board should have expertise and knowledge of mental health in each ICB area. I believe it is a view that is supported by the Centre for Mental Health and the Mental Health Foundation, that this has the advantage of not being prescriptive and not specifying that mental health representation should have a clinical focus or be the nominee of a particular mental health trust. This could help to contribute towards a more rounded conception of mental health, including public mental health representation or user-led representation or community organisation being placed on the board as the advocates for mental health services in their local area. This would help to ensure that integrated care systems do not become remote from their local communities, and the issues that really matter to the people are addressed from day one as the ICB board plans their services. Amendment 31 to require ICBs to have a balance of skills and knowledge is certainly a huge step in the right direction, and I again commend Baroness Walmsley for the work she undertook on this amendment. But it should go one step further tonight to guarantee that none of the 42 ICBs can leave mental health out of the room when crucial decisions are being made. My amendment does not constrain ICBs by specifying who can or can't bring mental health expertise onto the board, but it ensures that voice is there and in the room. And in doing so, it will benefit everyone's health and well-being, helping to create a more balanced and effective health and care system in every area and for all of us. I hope the Minister, as he said he would listen to the arguments, will accept this and, if not, clearly explain why not. I don't know if I beg to move now, but I certainly will at some point.
My Lords, I rise to support Amendments 9, 10, 14 and 32, but also to move Amendment 11, which follows on quite nicely from Lord Bradley's contribution. It refers to mental health, public health and secondary care services as absolutely vital to be represented on the ICBs. The bill, as published, leaves the membership of the ICBs very much up to local decision-making, and the Minister's Amendment 31 doesn't actually change that. It leaves it very much to the ICB to decide what the ICB should look like. And my concern is that ICBs may be dominated by managers from a range of organisations, perhaps including the private sector health bodies, and indeed such